I grew up in a small rural village in western Kenya with no electricity and no running water. And growing up in such a small rural area, I got to see firsthand the devastation that the lack of healthcare brought on people of my village. Because both of my parents were teachers, they really put a great emphasis on education. And so they wanted to make sure that all of the kids got to school. I got admitted to Dartmouth College in New Hampshire, and that was a huge cause for celebration, both for my parents and for my village. And so my village put together a fundraiser, and they sold their chickens and cows and goats and sheep, and to raise me the money to buy my plane ticket. I remember thinking to myself, well, this is not unlike the village where I grew up, and yet just as college students we were able to make a huge difference in their lives in terms of being able to bring them, build this women and children's clinic. We needed to act and do something to help our community, and part of that was we wanted to honor the legacy of our parents and to just turn things around for the community. Eventually, I landed on gastroenterology, which I felt would be a good mix of internal medicine. So I would still be able to see pretty much anybody at home in Kenya and also here in the US. What's most rewarding for me in gastroenterology is that I get to take care of patients with a huge breadth of issues, and things that we can fix, other things that we can help patients live with, and then being able to do preventive care. So that for me is a huge help in terms of being able to provide care within this community, and for people not to feel that it's just a community hospital. It's a community hospital, but with the reach that allows for excellent care. A lot of times when I go back home, I'm reminded of just how fragile the situation was when we started. And just, I wish they could have seen how far we've come and how much of a difference it's making on the people's lives.